Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back from the ad break. You are still watching Prime Life. Now, I'm joined by Ronald Abvajee, who is our wellness expert, and he will be discussing the importance of African Vaccination Week. And this annual event is actually crucial in promoting immunization. My data bundles are depleting, Sehoa, and raising awareness about the benefits of vaccination. And I think before we went to an ad break, while we're opening the show, we're speaking about the myths that actually are around vaccination itself. African people are scared of vaccination. So we want him to tell us exactly about the importance of it and just to raise awareness on this particular important issue. Thank you so much for joining us on Prime Live.
Always a pleasure.
Thank you. So, just for people who do not know about African Vaccination Week, the campaign itself, what is it all about and what's the purpose?
The amazing thing about African Vaccination Week is that many people think it's about schedules of vaccinations and syringes, but it actually is about giving back childhood and lives. It actually is about giving hope when we used to experience mass funerals of children dying because they weren't vaccinated. That is what the intention of African Vaccination Week is. And the theme for 2025 is making vaccines accessible to all, humanly accessible. And coming out of the COVID era and financial issues with different governments and states and funding organizations, it really is about addressing the opportunity that exists to give hope and the opportunity of living a healthy life to so many children in Africa. So African Vaccination Week is really a campaign to create not just information and awareness, but the action to transform people's thinking and approaches to vaccines to receive them rather than to wait until they get ill wishing they had them.
That's a beautiful way of explaining it, and also a kind of an encouragement to those who are watching to actually take the whole vaccine thing serious. What do you believe are the most critical barriers for vaccination acceptance in Africa? Because I think before also we mentioned that it's not something that's very common amongst African people. Is it because of, I don't know, the myths around it, or what's the barrier? What are the most common barriers that you've come across?
Well, number one is mistrust. I mean, the reality of Africa is that Africa was colonized. And in being colonized, we're dealing with the colonized approaches to healthcare.
Yes.
It wasn't about you, it was if and when needed, rather than, and if you had to die, you had to die. You were replaceable. And that is what the reality is we're dealing with. And then we're dealing with mistrust on government organizations and government departments. Because how do I trust you to look after me if, having a lunch catered for in Parliament is more important than making sure that I have bandages and plasters and sutures and nursing professionals. So mistrust is the number one thing. The second thing that we look at in regarding the African Vaccination Week and the different cultures, because we're in a beautiful blend of cultures and belief systems, is the cultural appropriation of what we believe vaccinations is. We know that in the African culture, we're steeped in African traditional medicine. And we know that 80 to 90% of Africans in Africa will first go see a traditional healer before they go to an allopathic or a Western medical professional. So it's about dealing with breaking down those kinds of narratives. And that stems from working with community leaders and other insightful leaders, not just to transfer information, but to actually make the information relatable. And then, of course, we're dealing with the financial issue, the economic issue. If you had the choice to take public transport 10, 20, 30 kilometers away to get your child vaccinated, or rather go to your job and not be fired, and or put food on the table. Food on the table and getting to your job to provide food on the table takes priority at that point. And that is the reality that we're dealing with. So these are some of the things that we're dealing with and why African Vaccination Week becomes so important.
And just to move on to, I mean, you mentioned about the mistrust situation, and I can actually attest to that, because if you look at the whole vaccination thing amongst African people, it's seen as a diagnosis. not a prevention. So it's like we need to be re-educated, and there has to be a level of building trust amongst the people, because as soon as someone says, let me vaccinate you for this, it's like, hey, I don't have that, I don't even want to have it. So we are wired like that. But let's talk about more about the challenges and how they can be overcome, because we have said mistrust and miseducation, but now let's talk about how we can overcome these challenges. What do you think can be done to eliminate such thinking?
Fundamentally, thinking of those custodians that need to inform and educate. Like, this is the World Health Organization program. That's how big this is globally, right? For the World Health Organization. Number one, we need to change our thinking. Not your thinking, our thinking. From, we must inform you, we must educate you. No, we need to make it relevant, and we need to make it resonant. It's got to connect with what's in it for you, and of course, how relevant is it for you?
Yeah.
So that's number one. And that happens through community leaders engaging consistently, and community leaders not standing on a podium preaching, but doing the vaccinations themselves and showing with action. I always say, leaders, corporate leaders, community leaders get very scared when I go for health campaigns, because I'm like, here, test me for HIV. Here, test me for this publicly. Why are you scared if you know that there's a benefit? The next thing we have to look at is really to look at it, supporting organizations that drive these campaigns. The benefit of African Vaccination Week, it closes the loop. It builds the health ecosystem, from cold storage to store the vaccines, to training of the health professionals, to ensuring that the supply chain is fully enabled in communities and other areas. And then, of course, you're saving lives. And then, of course, the last thing is to mindfully and consciously spread the stories and the narratives of those whose lives are now being saved. And the vaccine should be the lead indicator of getting it done, but the lagging indicator definitely needs to be, I can now actually go to school, I can finish school, I can add value back to my community, I can actually live a life. So I'm not worried about 6 foot under, I'm worried about 6 steps ahead of me. And if children have that opportunity, we are sharing hope, and we are making hope tangible. And that's some of the narratives we need to bring in more.
And just before we let you go, for our viewers at home, listeners who are listening right now, what are your final words or thoughts regarding African Vaccination Week?
I know so many people are afraid of needles. I know there's so many old school myths that we live with. But do you use encyclopedias, or are you using ChatGPT and other AIs? Wenna?
Nah.
Huh?
AI, ChatGPT.
Yes, Perplexity, Gemini. And that is because technology and technology has shifted. Science and accessibility is shifting. Last week we spoke about malaria. And malaria, I mentioned to you that the World Health Organization endorses 2 vaccines to stop malaria. A simple mosquito bite can kill your child. A vaccine will stop and prevent that. And that is what the opportunity here is. My input to people as we love and leave them is, don't let your fear of the unknown or fear of a needle stop you from saving your child's life.
And just right now, everybody's catching the flu bug. Everybody's getting sick. Winter's coming up. Should we get vaccinated? What's your advice on that?
Yes, but not when you are sick. Then it's a bit too late.
Is it?
Of course it is, because then remember, you are getting a non-active strain of the DNA of that of the virus. Now remember that there's a dominant 3 strains actually, of the flu virus around. There's a couple of others, but they're not as dominant. So when you look at that, is the flu virus prevents you from, one is potentially getting sick or getting seriously sick, and you can recover a lot quicker. So yes, if you haven't been ill yet, go and get your vaccine today. Mina, I went weeks ago because the flu vac has been around, because flu's here earlier. And you always say, no, my body will build immune. I mean, I know people out there right now in Northcliffe that are preaching, no, I'm not going for a vaccine. I'm going to wait. I'm like, good luck. Wait until you get sick, and the consequences could be dire and severe.
Okay, is because other people believe, okay, have your vitamin C's, your concoctions, ginger, what. Is that not, if I drink that, is that not building my body to be immune to the flu? Or should I still do both of them?
You must do both of them. You still need to prepare your body. It's like, for example, many people did this High Rocks fitness challenge. Now, you need to train specifically for High Rocks. I can't decide I'm going to jog 5 kilometers in the road every day and then I'm going to go do high rocks. They are they are exercise, but they are two different types of activity. So as you said, you got to be proactive with boosting your body's ability to fight germs and not necessarily the flu bug, but you can prevent colds and other things which are not as severe. But you still need to get the vaccine potentially, and this is what I say to people: it's your choice. But I would recommend that people get the vaccine to prevent them getting seriously ill, especially those that are immune compromised, those like me that have asthma, for children as well, and of course for parents. Because if COVID hasn't taught you anything yet and you're okay being that ill, I don't know what else to say to you, because you could get that ill again.
Well, Ronald, thank you so much for this beautiful conversation. I have learned a lot.
Always a pleasure.
Viewers at home, this was an amazing conversation. And if you did not know anything about vaccination, African Vaccination Week, I hope that this has left you well informed. As for me, I have changed the way look at vaccine, because I am amongst the people that are scared of getting vaccinated because of the mistrust, miseducation. But today, Ronald has shed some light on how we can approach and how vaccination is actually there to help you, and it's a prevention for you to not actually get ill. But without wasting any time, let's go to a quick ad break. We still have more content for you right after this.